afternoon, everyone, and to you, Ma'am Fabian. Today, I'll do demonstrating and do the procedures on how to take the blood sugar level of the patient. That's what we call the hemoglucose test monitoring. So first, identify the client. Hi, Ma'am. Good afternoon. I'm Alex. May I know your name? And also your date of birth. Then, prepare all the materials needed. I have here the glucometer or the blood glucose meter, the testing strips, the safety use lancets or the ejector lancets, and the pin lancets. And also I have the cotton balls, the dry cotton balls and the wet cotton balls, and also the disposable gloves, and the sharp pin and orange plastic disposable bulb. We use orange pin in the hospitals when we use the waste or medical equipment that are contaminated when we use after use. So, explain to the client what the procedure and obtain informed consent. Hi, Ma'am. Good afternoon, Ms. Ayu. I'm going to take your blood level sample today. Is that okay to you? The pain is tolerable than compared to other injections. Then, ensure the participant is comfortable and warm. Ensure all the equipments and documents a required procedure is at hand before doing or starting the procedure. Then, do hand washing. Then the patient should be asked to clean the area to be used, to obtain the sample with warm water and soap, and rinse thoroughly and dry. Then this is to ensure that the hands of the patient is free for the trace of the sugar or glucose that can lead to a falsely raised result. Be sure to not to use the baby wipes or alcohol gels that can impair the blood glucose result. Then next, prepare the glucometer or blood glucose meter and the testing strips. Insert the testing strips in the meter. So I will use insert the testing strips in the meter and the meter turns on. The instruction in this depends upon the types of the glucometer or the blood glucose meter that you're going to use. Be sure to avoid to touch the testing strips. Then prepare the glucometer and the testing strips and insert the glucometer pin at the lancet device and adjust the depth of the device in a comfortable penetration level. So I 2 or 3 adjust accordingly. If rough skin, you can dial a higher number. So for today, for me, I will prepare the number 2 since my patient is a female and has a soft skin, to lessen the the pressure when I poke the finger of the patient. So I will use number 2 now. My right hand or left? Meron na lang po. Ma'am, relax lang po. Ito na po.
Hangit ba? Parang mabaho. Sige. Kung kaya
Kahit-
mo, pisa-pisain eh.
Kahit iwaway ko po siya, hindi na kaya po.
Hindi na kaya.
I'm sorry. Hindi po, baka level 3 po yung sa inyo.
Seryoso?
Ano na? Siya. Try another one, ma'am. Sorry po. Level 5 na po natin. Try natin. Ano na po, relax lang. Try. Can use lancing device to obtain a small drop of blood. Allow 10 seconds to the site for bleed. Ako ma'am, hindi siya matagal na kasi ko.
Tingin.
Siya na.
Uulit ulit.
Ito lang.
Ako.
Yan, tagal ako. Natagalan yung insert na dapat kasi ito insert.
May timing kasi.
Allow 10 seconds to the side to bleed. If you need much more blood, then milk the finger from base to tip. 106. Then apply blood drop to the target area, to the testing strip, and into the blood glucose meter. Then, if the glucometer or the device is refilled with enough blood, the device or the glucometer will display the result automatically. Then apply a cotton wool in the puncture area and apply pressure. Document the result in a blood monitoring booklet and act accordingly if the range of the result is out of range. Then after care, remove or dispose the unused testing strips, and also the lancet pin. To the bin, orange bin, and preparation for the next test.
Thank you.
Ito hindi na pumasok. Ay, hindi ko po yun nakikita.
Picture.
Ang alam ko lang kung nag-drop yung lalaki.